Is knee replacement safe surgery? Again, a very common question. The answer is yes. The factors on which the safety of knee replacement depends are: number one, fitness of the patient. Number two, how long does it take for the surgery to be done? Number three, whether patient is having any comorbid factors like heart problem, kidney problem, liver problem. Number four, whether patient has got low immunity like rheumatoid arthritis, diabetes. So basically, for patients who are fit, they are medically fit, the surgery is very safe. For patients who are medically not fit, they need to be optimized, they need to be investigated, they need to be treated for underlying comorbidities, and surgery should be carried out. In a tertiary care center, knee replacement surgery is extremely safe to carry out, and morbidity and mortality is very low as compared to many other surgeries. Thank you.